Hujambo mpenzi mtazamaji popote pale ulipo, karibu kwenye makala ya wikendi ambayo tumekuandalia hii leo, ikiwa ni tarehe 21 mwezi wa 6 mwaka 2025. Na hii leo tunaangazia unyanyapaa na kukosa ufahamu wa ugonjwa wa selimundu, ambapo ni mojawapo ya changamoto ambazo zimekuwa zikiandamana na vita dhidi ya ugonjwa huo. Mwanahabari wetu Wafula Masika aliweza kumtembelea dada mmoja kwa jina Harriet Nasambu mwenye umri wa miaka 25, na licha ya kupitia changamoto hizo za unyanyapaa, ameweza kujitwika jukumu la kuhamasisha umma kuhusiana na ugonjwa huo wa selimundu. Na hii hapa taarifa aliyotuandalia hii leo.
Unapozungumzia unyanyapaa katika jamii, Nasambu ni shahidi wa kauli hiyo, ambapo anatuelezea kuwa kando na kupitia changamoto hiyo katika shule ya msingi na ile ya upili, hali hiyo imempa upweke wa mahusiano na kumshinikiza kuwa balozi wa selimundu.
I'm Harriet Nasambu, lakini watu wengi wananijua kama Jondi. I'm 25 years of age, a sickle cell warrior living with sickle cell disease. I was diagnosed when I was 1 year old. And since then, I've been on medication throughout. So living with sickle cell, it's not an easy task, just from when you're little. Kuna challenges mingi sana, tukianza na stigmatization. Kwa hii society yetu, ukiambia msee uko na sickle cell, they view you as someone who is different, outcasts. Wako na expectations fulani, they expect you to be weak, hauwezi fanya vitu fulani na fulani. So stigmatization is a very big challenge kwa sickle cell. Alafu drugs ni very expensive drugs za sickle cell. Alafu sickle cell bado hakuna information, hakuna awareness. So in as much as we try to ask for subsidies, bado drugs ni expensive very, alafu bado watu wengi hawajui condition. So tungeza tupenda kuuliza gava if they can at least subsidize those drugs for us, ama hata ikiwezekana zikuwe free.
Nasambu anasema kuwa jamii haina ufahamu wa ugonjwa huo, wengi wakisalia na dhana kuwa watoto walioathirika hufariki wafikishapo miaka 18.
Primary hakuna a lot of stigmatization, watu bado ni watoi kidogo, but it is still there. Kuna vile tu wase watakutenga, they view you differently. Alafu sasa come high school, that is where the real stigma is, because now you know you're teenagers. And people say a lot of things concerning sickle cell. Like, unaweza ambiwa hautafika 18, hautafika 20, or huyo anakuanga na sickle cell tu anaweza kufa any moment from now. I always tell people, sickle cell ni ugonjwa tu kama ingine. Just look at me kama mtu mwenye niko na asthma, mtu mwenye niko na cancer. Because when you tell somebody you have cancer, that's just normal. People don't see a big deal with it. But ukiambia mtu uko na sickle cell, wanafikirianga, I don't know, they think a lot of things. So in high school, I went to a boarding school, Cardinal Otunga Girls High School, Bungoma. From Form 1 to Form 4, I was a boarder. Na unajua tumaisha boarding, waking up at 4 a.m, kuoga maji baridi, and those things, baridi, it triggers crisis. Crisis ni ile pain ya sickle cell. And it is extreme pain, like it is very painful. So imagine ile kuamka 4, alafu unafasa uoge maji baridi, now the pain comes and you're supposed to go to class, lessons throughout the whole day. Alafu kuna ile kuchoka, you just know boarding, kujifulia, kujitafutia maji, all those things. So high school, I can say it was not an easy journey, but I managed. Anyone can go to a boarding school. It doesn't matter. Just take good care of yourself. In sickle cell, I'll say for my case, I experience pain in, let me say, 2 forms. There is mild pain and there is severe pain. So mild pain, you might just wake up, you have a backache, or you have a headache, or you have a joint ache, mostly they affect joints. It is the red blood cell, so it's inside your bones, so that's where the pain is. So for mild pain, you may not necessarily need to go to hospital. You might just take a bit of painkillers or just a drip and you'll be fine. But when it comes to severe pain, that's the pain that now you have to scream. You're screaming, you're in extreme pain. Maybe it's only your lower back, or it's your chest, or it's the whole body. You're in a lot of pain. So you either need transfusion or painkillers that have a higher degree, or you need a lot of water. So when you have pain and you're transfused, transfusion, I can say, is the best medicine for pain, for severe pain. When you're transfused, it tends to relieve your pain faster. I've been transfused a couple of times, but not so many times like my fellow warriors. I was first transfused when I was 2 years of age, and then I was transfused when I was 16 again. So from there, I had frequent crises and I needed a lot of transfusion. But I can say transfusion works. So far, I can say it's the best medicine for pain because it relieves that pain and you go for a while without pain. Transfusion ni kuwekewa damu, kuongezewa damu kwa mwili. So with sickle cell, your red blood cells are sickle shaped. They look like a crescent moon or a sickle, ile ukata nyasi. So when they pass through the bones, they transport oxygen. But now that they are sickled, they tend to stick together, and when they stick kwa hizo mifupa, oxygen does not pass through the other side, so it causes that pain. Sasa ukiongezewa damu ama ukiekewa maji, inaenda inafungua hizo mishipa, alafu oxygen inaanza tena kupass through, then it reduces the pain. Ni kama tu, unaona watu ukikimbia upande mlima sana, uanze kuhema, si unaanza kusikia uchungu kwa kifua, short of oxygen, until relax ama ukunywe maji utulize. So it's just the same. Sasa hiyo pain ni vile iko kwa bones. The worst experience I had with stigma, there are a couple, but I'll only say one. So I had this boyfriend and to lead it for a while, and when I came out and told him I had sickle cell, he kind of, I think aliogopa ama sijui alitetemeka, so the guy just changed, akaanza kuwa rude, like akaanza kuniview differently, and then he told me I'm only using my condition to seek for sympathy. So that, to me, sijui nitaiweka aje, but it was, I can say it's the worst experience I've ever had in terms of stigma. Juizi zingine tu mi assume, high school tulikuwa watoto, primary tulikuwa watoto. Kwa society, hapa generally, sijaona kama bado watu wanatutenga hivyo sana ka in schools. But ile ya ule boyfriend, that's what I knew people still need to know a lot and to learn about sickle cell. Let me not be specific with the year, but let me just say it was a few years back. So from that experience, that is when I came out now as an advocate. Instead of me channeling that anger or pain somewhere else, I decided it to be my strength, my stronghold for me now to be an advocate and advocate for awareness and start creating awareness, just so people can understand what sickle cell really is. It does not limit me from doing anything. I will just do anything or everything anybody else does. So from that experience, I learned to be strong, and I learned that if you want to speak up for yourself, nobody is going to speak up for you. And we need to demystify the myths around sickle cell, and we also need to end the stigma, because it is just a normal disease like any other disease, and it is manageable. It does not mean if I have sickle cell, it's a death sentence or it changes your perspective about me. Like I've said, the drugs are very, very, very expensive. The key drug is hydroxyurea, and one tablet goes for 50 shillings in pharmacies and chemists across the country, and that is flat rates. They can even go up to 80 bob or up to 25 shillings, and that's one tablet. Like for me, they give you prescription according to your kgs. So like for me, I take 3 tablets of hydroxyurea a day. So you can imagine if I'm buying a tablet at 50 bob and now I have to take 3, that is 150 per day. And I'm supposed to take it daily, like from Sunday to Sunday. And that's just the key drug. We have supplements like folic acid, PENDO, any other antibiotics. So treatment is really a challenge. And with the current state of unemployment in the country, like I, for example, I still don't have a job. So accessing those drugs is still a challenge because I have to rely on my parents, and they have to dig deep into their pockets just so I can afford those drugs to keep me going. So sickle cell administration, for one, I don't have a heavy flow. So mainly during my menses, I'm not affected. It's just a little pain that comes with it triggers. We call it triggers. So it may just trigger a little pain like back pain, but I can't say that my HB or my blood levels go low. But those with heavy flow, I'm sure they always have to get transfused or have to supplement with foods that are rich in iron. When you have a sickle cell crisis, like I said, you are in extreme pain, a lot of pain. You feel like your body is being ripped apart. You know, when somebody just takes a hammer or something and then they start kukugonga. So it is a lot of pain when you are in a severe crisis. You always want to get help faster. And sometimes when you go to hospital, you know, our hospital sometimes, people don't understand you are in a lot of pain. So you have to go through all those procedures and you're in a lot of pain. I will say sickle cell crisis is not a joke. When somebody tells you they have a crisis, you have to respond fast because that person might be dying the next minute out of pain, or it might cause stroke. I can't even find the exact words to explain the pain, but it is extremely painful because it is internal. So it is very, very painful, and then it causes a lot of complications. Like I've said, when you have a lot of pain for a long time, you might get stroke. We also have what we call a vein in sickle cell. It dislocates your hip on one side, so you have to limp. Then it also causes swelling of the spleen, sometimes even the liver. So it comes with a lot of complications. So I always tell people, when somebody is in a crisis, kindly respond fast because you don't know what's going to happen next. And what has kept me going over the years, I will say my parents, they are very, very, very supportive of me. They understand when I'm in pain. They have always been with me through this journey. And I can also say my friends. I have a close circle of friends and family who encourage me, who tell me to keep going. They always tell me I'm not limited to anything just because I have sickle cell. So I get my strength from them because they keep pushing me to be better and better despite having sickle cell. For healthcare practitioners, first of all, I would like to thank them because they're doing a really good job of managing us. Just a few of them that don't really understand, but majority of them are very helpful. They help us get through this because without them, there is no us. They always know how to take care of us, how to ease your pain if you're uncomfortable or something. But just for the few that don't understand, I will just urge them to do research, or try sitting or try even treating a sickle cell warrior and see what they go through, just so they learn. But our health practitioners are really doing a good job. As for the policy makers, maybe what I will say is that maybe if they can come up with policies that favor us, policies that can help us, especially in accessing those drugs, because drugs is the main challenge, I can say. And if we can also get specific or specialized hospitals and practitioners just for sickle cell, like we have oncologists for cancer and all that. So if you also get maybe just a hospital or a clinic that just is strictly for sickle cell warriors, it might also go a long way in saving lives and helping a lot of people. Under SHA, if you register, so sickle cell is categorized under disability. So this is what most people don't know. If you're a sickle cell warrior, just know you are categorized as a disabled person in Kenya. So kindly go process a certificate, get a disability certificate, and SHA will be able to cover your costs with that disability certificate. But without it, I don't think they can help you because sickle cell is categorized under disability. I personally, together with my fellow warriors, we are trying our level best to create awareness and let warriors know there is help, because if you access a disability certificate, you have a higher chance of getting better services. And we thank the government for considering us for that, because most especially warriors with the VN, they go through a lot of challenges. And when you have a VN, already you are disabled. So with that disability certificate, you can get a lot of help. For example, SHA. And also under SHA, we were given a package of 6,500. It helps. It is not a lot, it is not much, but for starters, it is working. It helps. So what I like to add the government is that if they can expound on that and just allocate a little bit more to sickle cell warriors, because we tend to go to hospitals so very many times throughout the year. You can go even up to 10, 15 times a year at hospital. But now that 6,500 only covers once. So if they can allocate just a little bit more of that money to that, it will go a long way. And on matters creating awareness, I personally work with a couple of warriors. In Bungoma, we have a group called as Bungoma Sickle Cell Family. It is a county-based, a county-based organization for warriors. We support warriors across Bungoma County. We come together, we walk this journey together, we give each other strength. And in my community so far, I support like 5 that, let me just say, are not able to access those drugs. So I try my level best to source for those drugs for myself and for them, for the 5 children, because as you can see around me, we are not in a really well-grown area. Naweza sema tuko mashinani, tuko ushago. So accessing those drugs kwa dispensary hapa, it is not possible. And the drugs are very... So I try my level best to source for those drugs from well-wishers, from those people that are always willing to support me, and I have quite a number. They do support me with those drugs, so I distribute them among warriors that I feel need them the most. And also, I go to schools and sensitize youths, particularly Gen Zs, on sickle cell, because it is only us who are going to cut the cycle of sickle cell disease. When you understand your genotype and you know your sickle cell status, you can be able to look for a partner that does not have the sickle cell trait. So in my family, my mom is a carrier, my dad is a carrier, that's why I have sickle cell. With sickle cell, I have to contract 1 gene from my dad and 1 gene from my mom It is a trait that is passed across. It is a genetic disorder. It is a genetic blood disorder, so I cannot contract it from anybody else. It has to be my parents, and with every pregnancy, there is a 25% chance you're going to get a child with sickle cell. With every pregnancy, if the two of you are carriers. So in my family, my parents are carriers, so I have the disease. And in my extended family, there are only two, my cousins' kids and I. So I can say the whole family, we are just 3 with sickle cell. So like I've said, I create awareness, I sensitize my community on matters sickle cell. I work with my CHPs hapa kwa dispensary. I work with them. The other day I was there giving them a talk about sickle cell. They do give me calls. We go to households and talk. They identify for me. You know, the CHPs ndo madaktari mashinani. They know these people. So they identify for me those people with sickle cell. I go talk to their parents and tell them and sensitize them and let them know it is the both of them that made this kid. It is the both of them that had the sickle cell trait. So I work with my CHPs very closely with them. And I also go to those public barazas, I go to those funerals, and I tell people about sickle cell. I just create awareness generally. Anyway, I'm given a platform. I sensitize the community and tell them it is a 2-man thing. It takes 2 to tango. So without one person, the other one cannot have sickle cell. So I try as much as possible to let the community understand it is the 2 of them that have the trait. It is not witchcraft the way people think. It is just a condition like any other, and it is manageable. You know, mostly when you go to hospital and you are told you need transfusion, initially you had to bring people to donate blood for you. But nowadays, we no longer do that because your blood has to be screened and all those things. So nowadays it is a very big challenge getting blood in hospitals because we all rely on one blood bank, and it cannot serve all of us because not only sickle cell warriors need blood, road accident victims, pregnant women, cancer patients, everybody needs blood. So blood, I can say the rates go with the hospitals because some hospitals really do charge for blood. Some of those hospitals charge blood. But I can say it's due to the scarcity of it in the blood banks. Not many people nowadays donate blood. I can only urge people to, when you're called upon to those, we always say there are those health camps, medical camps, or just go up or BCRH, go donate blood. You can always donate blood when there is a blood drive week. Just donate blood because it goes a long way in saving somebody's life.
Kulingana na daktari wa watoto katika hospitali ya rufaa ya kaunti ya Bungoma Dickens Lubanga, ugonjwa wa selimundu bado ni donda sugu eneo la magharibi mwa Kenya, japo wengi wamekumbatia vipimo vya ugonjwa huo, huku takriban idadi ya watu 1,500 wakiripotiwa kupatikana na chembe hizo.
Currently we are having a clinic, sickle cell clinic, Bungoma County Referral Hospital, that is able to take care of the population around. The clinic also harbors those other children with hemophilia, which is a bleeding disorder, and so they're incorporated together. But the number of sickle cell patients whom we are following so far is more than 1,500. That's at Bungoma County Referral Hospital. This is both adults and also young children. Then we also have a small group that has hemophilia. And so at least right now we have data that can help us to decide on which other interventions that you want to do as far as sickle cell anemia is concerned, because previously we did not have numbers. So we are having so many patients. Most of the patients were stigmatized. We did not have the confirmatory laboratory test that is now available at Bungoma County Referral Hospital. And so it was difficult for us. So most of the time we are sending all our samples to Eldoret before we could have a diagnosis. But we thank the county government because right now we are able to do the test at Bungoma County Referral Hospital, and the cost has been really subsidized to only 1,500 shillings for us to know our status. Remember, this is important because as part of our duty to reduce the occurrence of sickle cell, this is important even for those who are getting married or for those who are planning to have spouses, because they can know their status so that we are able to eliminate this disease called sickle cell within the community, because it's a very simple disease to eliminate. Just like the way people screen for HIV before getting married, it is something that you also encourage across the population, because when these children are born, actually they have a lot of challenges. The parents also have a lot of challenges. It is also economically disabling to most of these children and their parents, because it's very expensive to take care of a patient with sickle cell right from birth to the time that they leave. It is very, very costly, because they have to be on constant medications throughout. They have to be visit the hospitals on and off. They also have to be able to screen for other associated conditions that come along with, as part of complications of sickle cell anemia, which is very, very difficult. Remember, sickle cell affects almost all the parts of the body. It can affect the eyes, it can affect the kidneys, it can affect even the brain. You can get stroke. It affects basically all parts of the body. Remember, this is a genetic disorder, and it's a disease that if screening is intensified across, then you will be able to have better partners that you're able to choose, because at the end of the day, why we encourage reproduction is because you want our children to survive up to old age, if that is the age that God guarantees them. We don't want to have children who end up dying prematurely because of these congenital diseases, and that's why we know the cause. So it's something that can actually be defeated if the community embraces early counseling before setting down to have a family.
Lubanga anasema kuwa kubadilishwa kwa bima ya afya nchini kumeathiri wengi wanaofaa kuhudhuria kliniki za selimundu kwa kuhofia kulipia, kwani bima ya SHA hugharamia tu wanaolazwa hospitalini.
So currently the county government has tried a lot in terms of ensuring that our patients with sickle cell have got a home or have got a place where they can seek the services. So in the year 2023, we established the clinic for sickle cell and hemophilia, and it is being run Monday to Friday across the week. And so this has helped to bring all those warriors who have been affected by sickle cell together under one roof, whereby we are able to manage them, and ensuring that also we follow them up in the clinic to avoid getting complications that come in because of sickle cell anemia that has not been taken care of very well. So in the clinic we have qualified personnel who are able to do various tests, who are able to stabilize these children, who are able to do transfusions, because majority of them usually require blood either in one way or another in the course of their treatment. And so the clinic has really qualified people who are able to assist us. Another thing, like I said, is that the county government has also bought an HB electrophoresis machine that is able to enhance our testing capability within the county, so that we are able to have a diagnosis. I think this is the only machine that's available actually across the larger western province, as most of the other counties still don't have this machine. And so we're asking our people to come out and utilize this machine, because that is the only way we can know our status. So the only challenges we're having right now is a challenge that comes right from the top, that is in terms of SHA, because initially we used to see so many of these children in the clinics, that is for the daily clinics for sickle cell anemia. But now that SHA has categorized our hospital as level 5 hospital, now it means that they have to pay for outpatients when previously they are not paying for outpatients. So we've started seeing a reduction in the number of patients who have been coming in for checkups. And also, since SHA does not cover any bill that is an outpatient, including the drugs that they use like hydroxyurea, drug that they use for prevention of malaria, drug that they use to prevent low HB, and also to prevent infections. Now patients have to buy them right from their pockets because outpatient does not cover for those services. So because of that, most of our patients we are seeing a case whereby they have really dropped out. We're having fewer numbers, and so most of them come in already with the complications, so thereby needing admission. And so we have been having so many of these patients currently admitted in the hospital because they're not able to sustainably buy hydroxyurea and the other drugs that they require. Remember, like we said, a sickle cell patient roughly require between 6,000 to 10,000 per month to manage their complications and also ensure that they have at least hydroxyurea, they have PENDO, which we use to sort the infections, and also they have vaccinations which they require. And so that will be enough to sort them out. But now you find that most of our patients are not able to afford that. And so most of them now come in as cases of admission, which again means that we are now starting again to lose most of them since they come in late. And we have a perennial problem with the blood because our county does not screen blood by itself. We have to send blood to Eldoret for screening. And so this has been a big challenge as far as sickle cell management is concerned. So the next thing I wanted to mention is about menorrhagia. Menorrhagia is defined as heavy menstrual flows, especially for ladies who have already started having their monthly periods or their menstrual cycles. So menorrhagia is a common complications, and it does not select. Even those patients who have sickle cell anemia can still have menorrhagia. Menorrhagia is a disease on its own, and it is actually managed within our hospitals. So our patients who have, when you have sickle cell patients with menorrhagia, we still encourage them to seek medical care like any other patient. Remember, menorrhagia can have various causes. So that means that if you have sickle cell anemia, now you cannot have heavy menstrual flow because there are other causes that can cause that. Some of the causes that cause these heavy menses include infections like chlamydia and also other pelvic infections that may cause this heavy flow. Then there are also other conditions like uterine fibroids. So those are very common. Remember, these are growths or masses within the womb, and so these ones can cause actually bleeding or interfere with your menstrual cycles. But usually they tend to cause heavy menstrual flows. There are also other things that may cause heavy menstrual periods, like use of contraceptives, like IUCD devices. So when these are inserted, sometimes they might actually cause bleeding, and so which may be confused with the menorrhagia in any other patients. There are also those patients who will have hormonal imbalances. Remember, for us to achieve menstruation, basically it involves a balance of various hormones like estrogen. We have follicle stimulating hormone. We have LH hormone. So there are various hormones that come into play. And so when there's a problems in terms of the hormonal profile, that is in terms of if there's one that is higher than the other or one that is less than the other, then it can cause imbalances in terms of how the ladies tend to get their flows, their monthly flows. And remember, for menorrhagia, we are saying that at least it's diagnosed when you are losing at least 80 ml of blood per day. Or actually, if you are having heavy bleeding of more than 7 days in a week, actually more than 5 days in a week. So basically, that's how we define menorrhagia. Or ideally, if you're having, if you're putting on your pad and you are losing blood that actually even strips out of your pad, either to soil other clothes, then that one also we also term it as part of the symptoms of menorrhagia. So we normally ask that since patients who have got sickle cell still are still exposed to other diseases just like any other person, then those who have got menorrhagia, we ask them to come to the hospital so that we can identify which specific thing is causing this menorrhagia, so that they can be able to be assisted at that point. Remember, the way we normally say is not that just like any other chronic diseases, like HIV, that means that if you have HIV now, you will not have diabetes. You can still have HIV and you have diabetes and you still have hypertension. And so with sickle cell, it's still almost the same thing, so that you can have these other conditions while having sickle cell anemia. So that's why we normally encourage them that they come in for checkups, and usually we'll guide them accordingly so that they're able to be assisted. Thank you.
Na huku taifa likiungana na ulimwengu mzima kuadhimisha siku ya selimundu, na Sambu ametoa wito kwa waliobuni sera nchini kupunguza gharama ya matibabu ya ugonjwa huo, akisema kuwa ni ghali mno. Wafula Masika, runinga ya Pendo, kaunti ya Bungoma.